Hello friends, welcome to the channel Dewdear Academy. So in this video I am discussing an important topic, that is antihistamines. So this video will be useful for all job aspirants who are preparing for the different competitive examinations and also for the nursing students who are preparing for the different examinations in nursing. So the topic is antihistamines. Antihistamines we also call the antihistamine drugs as H1 blockers. So these are used to treat allergic reactions. Antihistamines, we know they are used to treat the allergic reactions. Antihistamines are used for the relief of symptoms associated with allergic rhinitis, allergic conjunctivitis, uncomplicated urticaria and angioedema. So how these antihistamine drugs are acting? They selectively block the effect of histamine at H1 or histamine 1 receptor sites, and thus it decreases the allergic response. So antihistamines, we know antihistamines, they are blocking the histamines, the effect of histamines. Where they are blocking the effect of histamines? At H1 receptor sites, okay, and thus it is decreasing the allergic response. So that is why they are known as antihistamines. So what is histamines? Histamines are known as the chemical messengers or mediators. Histamines are the chemicals that the body release during the allergic response. So we can consider that as a chemical messengers, which is they are acting as a chemical messenger in our body, and it is involved in different physiological processes like inflammation, immune response, etc. So we can say histamine is a amine, histamine, that is an amine, so derived from the amino acids, and they are responsible for causing the allergic responses. So antihistamines block the effect of the histamines at H1 receptor sites. So H1 antihistamines, they block the effect of histamines by competing with it for binding the sites on H1 receptors, primarily located on nerve endings, smooth muscles and glandular cells. So these H1 receptors are mainly located on nerve endings, on smooth muscles and also on the glandular cells. These H1 receptors are located. So antihistamines will be, H1 antihistamines are blocking the effect of histamine by acting on the binding sites on H1 receptors. Okay, so this blockade prevent the histamine from causing the different reactions. So in the body, if there is histamines produced in our body, they are causing different reactions in our body. That is vasodilation, increased vascular permeability, and also the stimulation of the sensory nerve endings. That is why we are getting the different allergic symptoms, itching, sneezing, runny nose. All these are effect of the histamines released from our body, and it causes these reactions: vasodilation, vascular permeability, and also the sensory nerve ending stimulation. So all these are causing the different reactions in our body, which is due to the effect of the histamine. So if we are giving this drug antihistamine, they will be acting on the H1 receptor sites, and thus it is preventing the reactions. Okay, so that is why how this vasodilation, antihistamines, how it will be acting, it will be reducing the widening of the blood vessels and thus causing the effect of reducing the histamine effect. Okay, so it will be blocking or reducing the widening of the blood vessels. That is how the action on vasodilation is being affected. Then vascular permeability, antihistamines help prevent the fluid from leaking out of the capillaries into the surrounding tissues, and thus it reduces the swelling and also inflammation. If we are giving the drug antihistamine, they will be preventing the increased vascular permeability, that is, it prevents the fluid from leaking out of the capillaries into the surrounding tissues, and also the stimulation of the sensory nerve endings. So antihistamines will be blocking the histamine from stimulating the sensory nerve endings. So there will be this the symptoms like itching, pain and any other uncomfortable sensations are there, they will also be reduced because if we are giving the antihistamines. So we can say antihistamines are a pharmaceutical class of drugs that act to treat histamine mediated conditions. So histamine, it is an endogenous chemical messenger that induces an increased level of vascular permeability, which leads to fluid moving from capillaries into the surrounding tissues. So overall outcome of this is increased swelling and dilation of the blood vessels. So when we are giving the antihistamines, they will stop this effect by acting as antagonist at the H1 receptors. So they block or they act on as antagonist at the H1 receptors. So the clinical benefit is reduction in the allergy symptoms and any other related symptoms. Okay. So that is the function of antihistamines. So we can say antihistamines are blocking the receptors. After the release of the histamines, they will be acting on the receptors. Histamine after release, it will be acting on the receptors. So the antihistamines are blocking the receptors. They are not blocking the release of the histamines from the mast cells. There will be release of the histamines from the mast cells and basophils. Histamines are mainly released from the basophils and mast cells. So the histamines will be released if there is any allergic reactions or anything, there will be release of the histamines. But the antihistamines are not preventing the release of the histamines from the basophils and mast cells. There will be release, but they will be blocking the receptors after the histamine is released. They are the histamines, the receptors are there, H1 receptors. So antihistamines prevent or block the receptors after the histamine is released. Okay, they are blocking the H1 receptors to prevent the action of the histamine at the sites. So we can say histamine is an endogenous chemical messenger. It induces an increased level of the vascular permeability that leads to fluids moving from the capillaries into the surrounding tissues. So when we are giving in case of the histamines, there will be increased swelling and dilation of the blood vessels. So when we are giving the antihistamines, they are stopping this effect by acting as antagonist at the H1 receptors. So the clinical benefit is the reduction in the allergy symptoms and any other related symptoms. So we can say this histamine receptors, there are mainly two types, H1 and H2 receptors are there, H1 and H2 receptors. And the antihistamine drugs that bind to H1 receptors are generally used to treat allergies and allergic rhinitis. So specifically H1 antihistamines are the drugs they are used to treat the allergic symptoms. And there are other histamine receptors, H2 receptors. The drugs that are binding to H2 receptors are used to treat the upper gastrointestinal conditions that are caused by excessive stomach acid. So upper gastrointestinal conditions are being treated by H2 receptor, the drugs that are acting on H2 receptors. The antihistamine drugs are mainly acting or they are binding to H1 receptors. So they are mainly used to treat allergies and allergic rhinitis. That is why we are specifically studying here H1 antihistamines, because these are the drugs, antihistamine drugs are binding to that bind to H1 receptors are mainly used to treat these allergic symptoms. So H1 antihistamines are what we are studying in detail today, and this H1 antihistamines can be again divided into two types, that is first generation and second generation. So first and second generation agents are there. The first generation H1 antihistamines, they more easily cross the blood-brain barrier into the central nervous system. But the second generation antihistamines do not cross the blood-brain barrier. So that is the first difference in the H1. So H1 and H2 are there. H1 is mainly used for treating the allergic rhinitis, and H2 is associated with treating the upper gastrointestinal problems because of the excess acid production. It deals with the it blocks the excess acid production, H2 receptors. But H1 is used to treat the allergic reactions, H1 antihistamines. Then H1 antihistamines are again divided into two types, that is first generation and second generation antihistamine drugs. So the first generation H1 antihistamine drugs crosses the blood-brain barrier. They can easily cross the blood-brain barrier into the central nervous system. But the second generation H1 antihistamines do not cross the blood-brain barrier. That is an important difference that you have to note. This is very important. Then the first generation drugs will bind to both the central and peripheral H1 receptors, but the second generation selectively bind only to peripheral receptors. That is another difference. So the first generation drugs are the drugs, they are binding both to the central and peripheral H1 receptors, but the second generation is selectively binding to the peripheral H1 receptors, histamine receptors only. That is the second difference. So H1 antihistamines include, or the H1 antihistamines are used to treat the different conditions like allergic rhinitis, allergic conjunctivitis, allergic dermatological reactions, sinusitis, urticaria, angioedema, atopic dermatitis, bronchitis, motion sickness, nausea and vomiting. These are the different uses of these H1 antihistamine drugs. Okay. And H2 antihistamine drugs are used in the gastrointestinal problems like peptic ulcer, acid reflux, gastritis, then Zollinger-Ellison syndrome. So these are the different uses of the drugs. So antihistamines, which we are discussing, the first the H1 antihistamines can be classified into two types, generation 1 and generation 2. So the different drugs are given, which are the drugs coming under the category of generation 1. Diphenhydramine is an example of generation 1. We can say this is most sedative. So generation 1, we can say they are sedating antihistamines, and generation 2, another difference between the generation 1 and generation 2 is these are sedating and generation 2 is non-sedating drugs, because they generation 1 can cross the blood-brain barrier, so they are more sedating, but generation 2 does not cross the blood-brain barrier, so they are non-sedating drugs. Okay, so most sedative in the generation 1 is diphenhydramine, and most potent is dimenhydrinate, hydroxyzine and promethazine. So just understand which are the drugs coming under the category of generation 1: diphenhydramine, dimenhydrinate, hydroxyzine, promethazine. So diphenhydramine is the most sedative one, and most potent is all other drugs which we have explained now. Then moderate sedative is phenyramine, meclizine, then biclizine. These are some of the drugs which are coming in the category of most moderate sedative, and moderate potent is cyproheptadine and cetirizine. Then less sedation or less sedative generation 1 H1 antihistamine drugs are chlorpheniramine, then mebhydroline. Then less potent is dimethindone and clemastine. So these are the different drugs. So most important one is the diphenhydramine, which is the most sedative one. This is an important drug. Diphenhydramine, or we will call Benadryl. The chemical name we can say Benadryl. So that is diphenhydramine. This is a first generation antihistamine. It causes the sedation. It causes sedation. So that is why if a patient is taking diphenhydramine, it is very important that driving or operating machinery should be avoided. If the person is taking diphenhydramine, that person has to avoid taking this, operating any machinery or driving. So that is very important. If a person is taking diphenhydramine, it is important to avoid driving or operating any machinery. That is a very important question. which we are seeing in different examinations. Okay, so driving or operating machinery to be avoided. And this diphenhydramine is also having an anti-emetic and anti-motion sickness activity is also there, because they are acting on the H1 receptors. So they are also having an anti-emetic property. So we can say this drug can also be used in motion sickness. This drug is also used in motion sickness. And another important thing about this diphenhydramine is that this is contraindicated. This is contraindicated for patients with glaucoma. If there is glaucoma, this diphenhydramine is contraindicated, because these antihistamine drugs are also having anticholinergic effect. This type of drugs, these antihistamine drugs, are also having an anticholinergic effect. So what happens is, it will be increasing the intraocular pressure, IOP. Okay, intraocular pressure will be increased. So what happens? The glaucoma will be worsened if we are giving these drugs to patients with glaucoma. So that is why it is very important these drugs are contraindicated. And also this drug can block the cardiac potassium channels, so that can lead to QT prolongation. If we are giving diphenhydramine in high doses, what happens? There can be QT in the ECG, there will be QT prolongation will be there. So this is also, we should be very careful if we are giving for the cardiac patients. So it can block the cardiac potassium channels. So these are some of the important things that we should note about this drug diphenhydramine. This is having anticholinergic property. So this is contraindicated in patients with glaucoma. This is also contraindicated in patients with BPH, benign prostatic hyperplasia. Okay, this is also contraindicated in patients with BPH. Because of the anticholinergic property, they will be causing urinary retention in patients with BPH. So it is dangerous in patients with BPH because it can cause urinary retention. So it is very important, if this drug is being prescribed for patients with glaucoma or any patients with BPH, that is the prostatic problems and all, we should question the prescription which is being prescribed because of these histories. If the patient is having glaucoma, the symptoms get worsened because of the chance of the increased intraocular pressure caused by this drug. And if we are giving to the patients with BPH, benign prostatic hyperplasia, there can be worsening of the problems because anticholinergic property is there for this drug, antihistamines. So it may cause urinary retention. So that is another important thing that we should be monitored. So this diphenhydramine is a generation 1 antihistamine drug and it is a very sedative drug. Okay. Then moderate classification is the moderate sedation or moderate potent drug is cetirizine. So cetirizine we are usually giving for seasonal allergies and all, but it is not that much sedating. It comes into the moderate level. Cetirizine is a less sedating one. Okay. Then we have discussed hydroxyzine, which is the most potent generation 1 antihistamine, hydroxyzine. So these drugs are used mainly for anxiety related insomnia. Also we are giving this drug hydroxyzine. We are giving for anxiety related insomnia. We know these drugs are generation 1, so they are having the sedating properties. So this drug will cause drowsiness. If the patient is taking hydroxyzine, it can cause drowsiness. So we can say this can also be given for insomnia associated with anxiety because of the sedating property, it causes drowsiness. So if we are giving any other sedative drug along with this hydroxyzine, if you are giving any other drug like diazepam, you know, these both the drugs are all CNS depressants, so excessive sedation can occur. respiratory depression, confusion, everything can occur. So this is also very important drug that we should learn. The hydroxyzine, this can be given for the patients with insomnia and all, because this is a sedating drug. It is having the property of causing the sedation. So there is a we should note the patients for any drowsiness, and also we should note if this patient is getting any other drug like antidepressant, diazepam, there the multiple effect will be there. Hydroxyzine and diazepam together if given, it can cause CNS depression, and that leads to excessive sedation and respiratory depression. Then another category is promethazine. The chemical name we can say it is Phenergan. Promethazine is Phenergan. So this is mainly we are giving it for motion sickness. So motion sickness, the most common drug which we are giving is promethazine, because it is given for the nausea, vomiting. It has anticholinergic and sedative property. So these are the different types of drugs which we are giving for the patients associated with the allergies, and also for the motion sickness also we are giving this antihistamine drugs. Then promethazine we should be very careful when we are giving to the patients with asthma. If we are giving to patients with asthma, the promethazine should be very careful, because promethazine is a first generation drug. It can cause because of the anticholinergic property, it can cause thickening of the bronchial secretions. So what happens? There can be worsening of the asthma symptoms. So that should be used in patients with asthma. Promethazine can cause worsening of the asthma symptoms because of the bronchial secretions get thickened. So this is another important thing that we should note with promethazine. So these are all the generation 1 drugs. Now we discuss the generation 2 drugs. Examples, mainly anti-allergic drugs are levocetirizine, then loratadine, then desloratadine and fexofenadine. These are all the different drugs which we are using as anti-allergic generation 2 antihistamine, H1 antihistamine drugs. So among these drugs, loratadine is an important category of drug that we should be familiar. Loratadine is safe in pregnancy. So which is the antihistamine safe in pregnancy? We can say loratadine is a drug which is safe in pregnancy, because this is a generation 2 non-sedating drug. It is not crossing the blood-brain barrier. So it is not causing the blood-brain barrier, so that is not affecting the fetus. So we can say this drug is safe to give in pregnancy. So safest drug in pregnancy is loratadine. If we are giving other generation 1 drugs, what happens? That they will cross the blood-brain barrier. It can cause sedation in fetus. But generation 2 drugs like loratadine does not cross the blood-brain barrier, so it is safe in pregnancy. Then we have anti-vertigo, anti-migraine drugs that are coming under the generation 2, that is flunarizine and cinnarizine. These are anti-vertigo, anti-migraine drugs which are coming in the classification of antihistaminic drugs. So these are all the different drugs which we are familiar as antihistaminic drugs, but each drug has its own different properties that I have been discussing now, and which is the most sedative ones and which is non-sedating drugs. All these we should be very much familiar. Next is examples of the drugs, that is what we have discussed, H1 antihistamines. There are generation 1 and generation 2 drugs are there. Then H2 antihistamine drugs which are acting on the gastrointestinal system. So that is cimetidine, famotidine, ranitidine, nisatidine and roxatidine. So these are the different category of drugs, but ranitidine is now removed from the market, and these are all the drugs which is acting on the gastrointestinal system. Then the contraindications, given the potential cardiotoxic effects of certain antihistamines, they are relatively contraindicated in patients with QT prolongation. Patients using other QT prolonging drugs require careful monitoring for further prolongation of the QT interval due to the risk of cardiac arrhythmias. So we should be very careful in case of arrhythmias. It is contraindicated in case of arrhythmias. Then in pregnant women also there is a contraindication, and additionally women who are lactating should also avoid the use of antihistamines. Pregnant women and also the lactating women should avoid the use of antihistamines, and loratadine is one of the safest drug which can be given in pregnancy. Then patients with impaired renal or hepatic function should also use antihistamines with caution. So hypertension, cardiovascular diseases, urinary retention, increased ocular pressure are relative contraindications to the use of antihistamines. So this is what the same we have discussed: pregnancy and lactation, renal or hepatic impairment, and also arrhythmias. Special care should be taken when these drugs are used with the history of arrhythmias or any prolonged QT intervals, because of the fatal arrhythmias can be occurring when we are using these drugs. Then which are the adverse effects of antihistamines? So there are some adverse effects, that is we know these are the antihistamine drugs cause, the generation 1 is causing sedation. So in the CNS there can be drowsiness and sedation, and in the GI system there is drying of the GI mucosal membrane, GI upset and nausea. Then the genitourinary system there can be dysuria and urinary hesitancy, and the skin eruption and itching. So some of the adverse effects from the use of antihistamine, because it is also having the sedative and anticholinergic properties, so there can be associated other and adverse effects are there, which we have mentioned now. The next is the monitoring. The dose of the antihistamines may require monitoring, especially during prolonged use. So patient should be monitored for the anticholinergic effect, and there can be the cardiotoxic effect of the antihistamines should also be monitored on ECG for any prolongation of the QT interval. The next is the toxicity. So there is no specific antidote for the treatment of antihistamine overdose. However, physostigmine may be an option if a patient is experiencing any delirium or other toxicity side effects due to the anticholinergic effect of antihistamine. So physostigmine is an option if there is any delirium or any toxicity side effects because of the anticholinergic effect of the antihistamine. We can give physostigmine as an antidote, but there is no specific antidote. Then there are some drug interactions with this antihistamines, that is monoamine inhibitors. So anticholinergic effects may be prolonged if diphenhydramine is taken with monoamine inhibitors. So diphenhydramine and monoamine, if taken together, what happens is there can be anticholinergic effects get more prolonged. So that is one of the interaction. Another one is ketoconazole or erythromycin. There can be interaction with ketoconazole or erythromycin. So which drug, that is fexofenadine, is one of the antihistamine. It may get interacted with ketoconazole or erythromycin, and that may raise the fexofenadine concentration to toxic level. So that is another drug interaction. So if we should be very careful if the patients are taking the drugs like monoamine inhibitors and also the ketoconazole or erythromycin drugs. There can be drug interactions. So thank you for watching this video.